Amid all that is COVID, there's a greater crisis than the pandemic that brought the world to a shuddering halt for 2 years. The over-exaggerated media hype and the government fear-mongering has done more to destroy states and economies than COVID itself. COVID is now with us. However, compared to the impact Victorians will face because of government incompetence and mismanagement, both prior to and during the pandemic, the greater crisis, far more destructive than COVID, with longer lingering generational impact, is Victoria's health system and the restrictions on elective surgery in Victoria. Now, as a state, how has the Andrews government allowed the system to get to where it is? A system he has overseen for 12 out of the last 16 years. Today marks 125 days and counting of elective surgery restrictions in Victoria. What is Premier Andrews doing? The answer is clearly nothing. On March 25, 2020, National Cabinet halted non-elective elective surgery on the advice of the AHPPC. After a month, the federal government announced that elective surgery would slowly be allowed to commence at 25% of usual surgery capacity. But here in Victoria, COVID remains an excuse not to resume elective surgery, and Victorians are suffering for it. Victorians with cancer who are waiting for the Andrews government to lift restrictions so surgeons can diagnose and remove cancers. So has COVID cured cancer? Obviously not. But 2020's figures released by the Cancer Council of Australia show there were almost 165,000 fewer diagnostic procedures carried out for 14 different cancers. These figures also show that actual cancer treatments have also dropped by 9%, with over 11,000 fewer procedures conducted to remove skin cancers. The Cancer Council report estimates that currently there are some 3,500 Victorians that remain undiagnosed with cancer. Now, if we fast forward to 2023, many of these cases will result in last stage diagnosis, a death warrant willingly imposed by the Andrews government. And what about workers with injuries unable to recover and return to work until their work cover approved elective surgery is performed? It's a crisis because the system, run down prior to COVID's ravages, is on the verge of collapse. And not central to it is COVID, but Daniel Andrews. Andrews has been at the heart of many things that have contributed to the ruination of Victoria and Victorians' health system. It's along with the economy, and they're so telling. Both go hand in hand in ways where each are intrinsically linked. Now, Victorians are waiting for elective surgery for procedures for cancer, face a grim prospect of dying. And COVID is a smokescreen Andrews is using to divert attention away from a problem he's created and overseen and is incapable of fixing. Here's a scenario that more than likely is played out between surgeons and their patients on a regular basis. And one would be hard-pressed to deny it would be a difficult discussion surgeons would have to endure, or patients would want to hear uttered from the mouths of the very people they entrust their lives with. Imagine you need to have surgery to have a cancer investigated, diagnosed or removed. You ask your surgeon, when will the surgery take place? And the surgeon replies that they are waiting for the government to allow elective surgeries to resume. But then Dan Andrews says, it will be better if we all just wait a while. Elective surgery is set to resume in New South Wales and South Australia, but not Victoria. Why? Why must Victorian patients who have cancer suffer pain and disability and be forced to live and wait with that uncertainty? Why is Victoria so far behind other states throughout Australia? Elective surgery is essential surgery. It's medically necessary, life-changing, limb-restoring, and can diagnose and cure cancer, fix chronic pain and disability, and it enables people to walk, work, use their hands, be independent, even toilet, and much more. The narrative that the broad brush elective surgery restrictions are needed so that private facilities can help with the COVID response is a false narrative. It's false a narrative as most things the Victorian government says and does. We need a nuanced approach, and it's necessary along with a roadmap. Other Australian states have had to continue to have lighter and more nuanced elective surgery restrictions. So why is Victoria unable, or worse, unwilling to allow elective surgery to take place when other states can and do? The answer simply lies in the dilapidation of Victoria's health system and COVID being used as Andrew's excuse. Victorian patients deserve better, and their pain and suffering must end now. But hey, at least Victorians were granted permission to attend the tennis and the Boxing Day test.